Hello, my name is Irene and I'm taking specialty in oncology nutrition, and we are going to talk about prostate cancer. So prostate cancer happens to be the commonly diagnosed malignancy for men in Kenya, and for the causes of prostate cancer, it's still unknown, but hormone androgen acting via the androgen receptor appear to surpass the development of prostate cancer. So let's go to the risk factors of prostate cancer. One happens to be age. So for people who are above 50 years old happen to be more at risk to prostate cancer than people below the age of 50 years. So we also have the race, nationality, family history, diet, obesity, physical activity, and infection. So let's also talk about the treatment modalities. And for the treatment of prostate cancer, it depends on various factors, which include the age of the patient, cancer stage, and other medical complications. For prostate cancer, when it's still in the early stage, we always advocate for hormonal therapy. And for the less aggressive tumors, we go for watchful surveillance, watchful waiting. So let's also talk about the treatment modalities. Now we have surgery. So surgery has also its side effects. So for the side effects of surgery, it will include urinary dysfunction, erectile dysfunction, and infertility. For the radiation, it also has its side effects, which include urinary dysfunction, erectile dysfunction, bowel dysfunction, and infertility. For hormonal therapy, the side effects will include hot flashes, loss of bone mineral density, and weight gain. So let's talk about nutrition issues pertaining prostate cancer. So with prostate cancer, plant-based diet may help lower the risk of prostate cancer. So let's start with fruits and vegetables. Fruits and vegetables are very rich in fiber, which appear to be fighting cancer. We also have polynutrients, which lower the risk factors of cancer. But for tomatoes, the recent research shows that higher tomato sauce intake results in to overall incidence of prostate cancer. Let's go to dietary fiber. Dietary fiber, we are talking of plant-based diets, which is also very high in fiber, which also shows to be of help in the prevention and management of prostate cancer. For refined carbohydrates happen to be the biggest cause for lifestyle diseases. By that I talk non-communicable diseases, where we have hypertension, diabetes, and also cancer is also in the bracket. So refined carbohydrates has been associated with prostate cancer. Let's also talk about dairy products. So many research show that, interestingly, whole milk is associated with decrease in prostate cancer. So intake in whole milk happens to have benefits for in the decrease and lowering the cause of prostate cancer. For green tea happens to have very, very high amounts of phytonutrients, which are known to exhibit several anti-cancerous properties. For dietary fat, it has been implicated as a risk factor to prostate cancer. And by dietary fats, we are talking about saturated fats and trans fats. For vitamin E has promising in lowering the risk of prostate cancer in the early and advanced stage. So for vitamin D also has at least shown protection against prostate cancer. So people with higher vitamin D have shown to be at higher side of not getting prostate cancer. So for the last thing, we are going to talk about body weight and physical activity. So people who are obese are at risk of not only prostate cancer but all types of cancer. So physical activity is highly encouraged not only to prostate cancer, not only to all types of cancer, but also to all lifestyle diseases. Thank you very much.